Among those who gathered to witness the launch of President Museveni's new strategy on fighting HIV and AIDS included ministers, members of parliament, officials from the Uganda AIDS Commission, and district health officers, among others.
We did launch the test and treat last year.
Museveni opened his address by criticizing government players who have failed to reach their targets in improving the health of Ugandans, especially in reducing new HIV infections.
I think the worry of the district sickness officers is that if all those are done, they will have no sick people in the hospital.
He also took a swipe at the Uganda AIDS Commission, blaming it for failure to provide regular updates on the state of HIV in the country.
Now, the mistake has been with this AIDS Commission. It is their problem. It is their problem. They don't talk. They don't talk. I don't know what they do.
Museveni also turned his guns towards people living with HIV who deliberately spread the disease to others.
When you are a biological weapon, killing other people biologically, and you think we should just keep on begging you? Huh? Don't you think we should handle you like Saddam Hussein?
The Presidential Fast-Tracking Initiative on ending HIV and AIDS is hinged on a 5-point plan that will be used to guide the campaign to its success. In the President's Handbook, Museveni says prioritizing an engagement with men in HIV prevention will help address gaps in preventing new infections, particularly among adolescent girls and women. The other points include accelerating the implementation of testing and treatment, particularly among young people, consolidating progress on eliminating mother-to-child transmission of HIV, ensuring financial sustainability for the HIV response, and ensuring institutional effectiveness for well-coordinated multi-sectoral response. Museveni's last call was on testing and treating for all.
I don't want to have some other ideas of involuntary testing, where we come and find you and grab you and we say, so please, go for testing.
However, the country still faces a challenge in funding its own HIV and AIDS budget. Over 68% of support is from foreign donors. The government is now eyeing an AIDS trust fund.
So we hope that very soon when Parliament reconvenes, this fund will be, the trust fund regulations will be passed by Parliament, and of course the fund will be established. So this should be before close of this year, and of course we hope to get 2% from the beers and the spirits and other alcoholic drinks as part of funding to this HIV/AIDS response in the country.
According to the 2016 Uganda Demographic Health Survey, up to 1.5 million people are living with HIV and AIDS in Uganda. Walter Mwesije, NTV.